You have been prescribed an intravenous medication known as parenteral nutrition. Parenteral nutrition is often called PN. PN is prescribed when extra nutrition support is needed or when nutrients cannot absorb through your gut properly. PN contains water, minerals, electrolytes, calories, carbohydrates, fats, and proteins. You may need to add vitamins or other medications into your PN bag before infusing. Depending on your diagnosis, you may not be able to eat while taking PN. If you can eat, it is important that you follow the type of diet prescribed to you by your healthcare provider. Eating foods not on your prescribed diet may lead to nausea, vomiting, or diarrhea. This can cause dehydration or electrolyte imbalance. If this occurs, your healthcare provider may order you IV fluids. Your PN will be administered daily through a central venous catheter that sits in a large vein near your heart. Common catheters used for PN include Port, Pick, and Hickman. Do not use your catheter if your catheter site looks infected, has drainage, or causes you pain. Do not use your catheter if you are unable to flush your catheter with a saline syringe, your catheter breaks, or your catheter becomes dislodged. Always contact your healthcare provider right away. You will clean and flush your catheter before connecting to PN in the evening and after disconnecting from PN in the morning. Each week, you will have your blood drawn and your catheter dressing and cap changed. This will be done by a home health nurse or at an outpatient facility. Always keep your catheter and dressing clean and dry to prevent infection. If your dressing becomes wet or edges begin to lift before your next dressing change is due, call your home health care nursing agency or outpatient facility to schedule a dressing change. Your home infusion pharmacy will deliver an IV pole or backpack and an IV pump. You will receive a weekly delivery of PN bags, medication vials, and catheter supplies. Keep the PN bag and supplies away from pets and children. If you are missing supplies or need additional supplies, call your home infusion pharmacy. Your PN bags and medication vials must be stored in a refrigerator. Remove your PN bag from the refrigerator 8 to 12 hours before your infusion is due, so you do not infuse cold fluids into your bloodstream. Never speed up the warming process by laying the PN bag in direct sunlight or by using heat. Your PN infusion will begin in the evening and end in the morning. Most PN infusions will run over 12 hours. It is important that you infuse your PN as prescribed and do not skip doses. Missing a dose of PN can make you severely ill and may require hospitalization. If you miss a dose of PN, you need to call your healthcare provider right away. Home self-monitoring is a daily record of your hydration status, weight, temperature, and glucose or blood sugar level. Dehydration and bloodstream infection are the two most common reasons patients return to the hospital while receiving PN therapy. To monitor signs and symptoms, you may be asked to perform home self-monitoring. Dehydration occurs when more fluid leaves the body than enters the body. To monitor your hydration status, record the amount of fluid that enters and exits your body over a 24-hour period and weigh yourself daily. You will be given measuring devices to measure your fluid intake and output. A bloodstream infection occurs when bacteria enters the bloodstream and makes you sick. To monitor symptoms, check your temperature daily. Bacteria can enter your bloodstream if you do not clean your hands before touching your IV catheter, or if you do not clean your catheter before attaching a syringe or IV tubing. Glucose, or blood sugar, is measured by testing urine using a glucose strip or by testing blood using a glucose meter. Record sheets should be filled out daily and sent to your healthcare provider as directed. Your discharge plan will be coordinated by your case manager. Your case manager will arrange your home infusion pharmacy for PN and supply delivery and your home care agency or outpatient facility for your catheter care and blood draws. Before leaving the hospital, a nurse may give you lessons on how to care for your catheter at home. Let's review what you've learned. PN supports your nutrition and hydration needs, is administered daily through your central venous catheter, is delivered weekly from your home infusion pharmacy, and must be stored in a refrigerator along with medication vials. Once a week, your IV catheter dressing and cap will be changed and your blood will be drawn by a home health nurse or at an outpatient facility. Your catheter must be cleaned and flushed twice a day. You may be asked to perform daily home self-monitoring to track your hydration status, weight, temperature, and glucose levels. Monitor yourself for dehydration and bloodstream infection. Your case manager will arrange your home infusion pharmacy, home care nursing agency, or outpatient facility for your catheter care and blood draws. Before you are discharged, you may have a nurse-guided lesson on how to care for your central line catheter.